Okay, I think we're going to go and get started. Folks are coming in. We're so pleased to have you here with us. We have a packed hour ahead for you, so we want to make sure that we make the best use of your time and that you get the most out of this webinar as possible. Thank you for coming today. This is the first webinar of our brand new Canadian Medication Safety Network. Our team is really grateful that you have taken time out of your busy day to come to this first event. My name is Melissa Sheldrick, and I'm the Patient and Family Advisor at ISMP Canada, and I will be hosting the webinar today. We would love to hear where you are joining us from. ISMP Canada is a pan-Canadian organization. We have folks from all across the country. And so we would love to hear where you are joining us from. If you are in the snow in Nova Scotia, if you are on Victoria Island, if you are in Yellowknife, please tell us where you are located in this beautiful country of ours. And I think we have folks joining from out of the country too, which is really cool. So when we started thinking about this network, we discussed how we were going to put this community together and wondered, what would the interest be for a medication safety network? And wow, are we so delighted at the interests that have been shown. Our network is growing in numbers by the day. And there really is a clear need to support this forum and to create a place where patients and caregivers and residents and healthcare providers, prescribers, and quality and patient safety specialists, and to bring all of these people together in one place is a really unique and special opportunity. There doesn't seem to be a lot of similar networks like this across the country, so we are just so proud to be able to host this network and bring all of you together in one place. So I would like to start our webinar, as we always do at ISMP Canada, with our land acknowledgement. And this land acknowledgement is based on the location of our office in Toronto. We acknowledge we are hosted on the lands of the Mississaugas of the Anishinaabe, the Haudenosaunee Confederacy, and the Wendat. We also recognize the enduring presence of all First Nations, Métis, and the Inuit peoples. We are grateful to live, work, and play on this land, and we want to contribute to the implementation of the Truth and Reconciliation Commission's 8 healthcare-related calls to action. We would invite you to also put your land acknowledgement, if you wish, in the chat box as well. So we would like to learn more from all of you, and in a moment, we will launch a poll. We're all here to improve medication safety. That's our common goal. And so it's going to be really important in this network to continue to hear from you and to hear your voice. So we do have 4 questions to start off the webinar. What is your primary role in healthcare? So you'll be able to check, you'll be able to select it. Have you or someone you know experienced an issue with medication safety? That'll be a yes or no question. And what matters to you about this webinar? You'll be able to check all of the selections that are there, the ones that apply to you. And then tell us one word that makes you think of medication safety. We're going to pull all those words together and make a word cloud to share at the end of the webinar. When Rajiv launches the poll, you will have to scroll down to see all 4 questions. So Rajiv, if you will go ahead and launch that. So it should be on your screen now. And as I said, you can scroll down to find all of the questions. Okay, we've got nurses coming on.
Okay.
quality improvement, patient safety professionals, pharmacy, people with lived experience or caregivers. This is fantastic. This is exactly what we want to hear. Yeah, we want to hear more diverse perspectives. Let's learn from each other, learn what's going on across the country, meeting people in the field, right? Networking, so important, learning more about medication safety. Resources are always important, learning about roles. This is fantastic. We'll just wait about one more minute, Rajiv, and then we'll be able to take it down. And I'm so looking forward to seeing all of your words and building that word cloud for the end of our webinar to see, what is it that makes you think of medication safety? What are those words? Okay, Rajiv, I think we'll stop it there.
Sounds good, Melissa. I'll end the
Thank
poll
you.
now.
That's terrific. Thank you. Okay. So here's our timeline for today. We're going to hear from Carolyn Hoffman, ISMP Canada CEO, in just a moment, and she's going to welcome you and share some of the goals of this network. And then we are so privileged to welcome our guest speaker today, Dr. Leigh Chapman. And after that, I'll come back and explain how the breakout rooms will work, and then we'll come together and wrap up. So with that, I'm going to turn it over to Carolyn.
Thank you, Melissa. Welcome, everyone. We are so excited you're here. We've been waiting for you for months, and now today is the day. I did want to make sure you knew that ISMP Canada is hosting this Canadian Medication Safety Network. The team at ISMP Canada thought it was important to engage and interact directly, and you're validating that. Right now, we see over almost 110 participants and counting coming in. So your voice matters, and it's important for you to know that, and we know that. And we need your input. We want to inform our learn, share, and act cycle that we continuously do at ISMP Canada, learning from incident reports, analyzing them, sharing the findings and recommendations out through bulletins, newsletters, programming that we do, and then partnering to take action, to actually work with you to know whether it makes a difference or not. So we're here to listen, and we're here to develop the network. And on the next slide, you see some of our goals. This network is providing a chance to hear, and through that, we will create a community to exchange medication safety information between healthcare providers and consumers. We want to obtain your information that you want to share, your advice on specific topics, and we have primed you today to do that, and shortly we'll be collecting that information. And then we want to provide very important medication safety tools, resources, and related information to you on an ongoing basis. So with that, we would say that some of the key ways we know today that we're going to interact with you is through webinars like this. We're also going to be on social media. We invite you to engage with us there and develop that. And when you registered, you have the option to sign up to get emails from us for information, but you can also go to our website. It's always a great source. This is what we're starting with, and this is what we want to know. Is this resonating with you? Is this what you need in your practice, in your experience as consumers to help you stay safe with medication? And with that, back to Melissa. Melissa, I would just say a big thank you to you, Rajiv, and the many ISMP Canada staff members and partners that are actually working with us today to deliver this webinar. Thanks.
This is definitely an amazing team effort. I am just so pleased to welcome Dr. Chapman to our webinar. We are so grateful that you are here today. Dr. Chapman is the Chief Nursing Officer of Canada, and she's committed to advancing the nursing profession and ensuring equitable access to quality of care for people in Canada. As Chief Nursing Officer, she provides strategic advice to Health Canada, to address pan-Canadian priorities, and she represents our federal government at domestic and international forums as well. She's been traveling across the country, convening, engaging, collaborating with the nursing community to identify workforce issues and innovative solutions. And she's dedicated to improving healthcare in Canada. So we are so pleased to welcome her here. Thank you, Dr. Chapman. I'm going to take the slides down so we can see you.
Amazing. Thank you so much, Melissa and colleagues. It's wonderful to be here. Bonjour tout le monde. I'm delighted to just say a few words to kick off, help kick off your webinar today. As Melissa said, I'm the Chief Nursing Officer for Canada, and I've been in this role since August of 2022. So this was a role that had been eliminated in about 2011, but it's existed in Canada since the late 60s, and it was eliminated under the Harper's Deficit Action Reduction Plan. And then, of course, there was a desire to reinstate the role as a result of advocacy from the Canadian and international nursing community. And I think it's safe to say COVID sort of eclipsed many other priorities, as you can imagine. So the role was then reinstated in 2022. And about 70% of countries around the world have a government chief nursing officer, just for context. So when I was appointed into the role, you know, I'm an RN from Ontario. I've been an RN for over 20 years, and I really made a concerted effort to visit every province and territory to ensure that I'm hearing the nursing perspective truly from coast to coast to coast. I can actually say that now because I've been up to the Arctic Ocean, visiting with nurses up in Inuvik, Northwest Territories, and rural and remote parts of Nunavut and Yukon as well. So certainly, you know, it's been very clear to me that there are some significant challenges in healthcare, and we're working very hard to try to remedy some of these structural issues that really need to change in healthcare. Certainly, when I think of my career in healthcare as a registered nurse, I started my career in critical care. And at the time, I'm dating myself, this is just over 20 years ago, McMaster was both an adult and pediatric hospital. I know it's now a pediatric hospital, but at the time it was adult and peds, and I worked in the ICU. And so you can imagine the medication dosage calculations and how challenging they were in the ICU, where a decimal point really could make the difference between life and death when we were titrating life-saving drugs and so on. And so that was, you know, something that was really instilled very early in my career. And I was someone who almost dropped out of nursing school when I learned that I had to do math. But you can imagine how this is sort of magnified when we think of nursing across the country. We're the largest group of regulated health professionals in Canada, with over 460,000 nurses. And we are often most proximal to the point of care. And so, you know, the challenge and the demands on healthcare providers currently, with the duress of the health system challenges that we're facing, are quite acute. And so often, you know, there's significant challenges when it comes to medication administration and medication safety. And these are, you know, I really will advocate that these changes that are required are structural in nature and really at the organizational level. And the only way to achieve change and the reform that's needed in healthcare is really through working together. So one of the things that I've prioritized in the year and a half since I've been in this role is a nursing retention, which is really aimed at optimizing the working conditions for nurses. Knowing that there are things that need to change in terms of how we're valuing nursing work and how we're valuing their contribution to care. So we released an executive summary of a nursing retention toolkit in October, just prior to the federal, provincial, and territorial health ministers meeting. And we will be releasing the full toolkit in the coming month or so. But it really does identify structural changes that are needed and things that employers and health authorities can focus on to really look at nursing work. I think it's absolutely imperative that we find these opportunities for collaboration, and working, with not just providers, but also with patients, with the recipients of care is essential to ensure that we're actually being of service, right? Healthcare is a service industry, and we need to hear from those who are recipients of care. And value that lived and living experience perspective. So I think that, in keeping with the theme of today around learning, sharing, and acting, that model is exactly what we need in Canada when thinking of initiatives that are underway in particular jurisdictions or particular organizations. These are things that can be scaled and spread across the country. We can learn from these exemplary and promising practices, and really hopefully break down silos and think about how patient care is very seamless in Canada. It really does transcend organizational borders or boundaries and jurisdictional borders and boundaries. And so that really is, I think, a call to action for all of us to work together and to find those opportunities to really coalesce. We don't need to reinvent the wheel, but there's things that we can absolutely scale and spread across the country. And this is a wonderful forum for engaging in that collaboration. So I really want to thank you for the opportunity to be here and be part of your webinar, and hope it is a fruitful discussion for the rest of the hour that remains.
Well, I can't thank you enough for your time. We're just so privileged to have you here and to hear from such a leader in this country who is working to make meaningful change, not only in the nursing community, but really for everybody who lives in Canada. And you're so right that that message of patient-provider collaboration is really the best way to move this forward and the best way to layer in those safeguards to prevent harmful medication errors from happening. So thank you so much for your time. We know how busy your schedule is, and we are truly, truly grateful. Thank you.
Thank you for the opportunity. Take care.
Okay, let's go back to the slides with any luck. There we go. Okay, so one of the best ways to learn from each other, to hear from you, is to talk in smaller groups in breakout rooms. So when you registered for the network itself, we asked you, what were your concerns with medication safety? What were you hearing? What were you seeing? And what were you experiencing? And we gathered a whole repository of information from you. So thank you for giving us that. And this is really what is going to inform how we move forward, that ongoing feedback, those ongoing issues, this ongoing conversation. So for today, for our first webinar, we chose some of those topics and included a couple of others to engage you in conversation specifically about those topics. When you registered for the webinar, you were asked which breakout room you wanted to go to. And so in a moment, Rajiv is going to work his magic and he's going to send us all to our different breakout rooms. In your breakout room, so you see the 5 different topics that are there: enhancing communication for medication safety around errors, designing a consumer-focused website. That's work that ISMP Canada is working on, evaluating our website, our home website, and then an open dialogue room with, some informal sharing of feedback on medication safety. And so as we send you out into these breakout rooms, this is really the goals that we would like for you. When you get into your breakout room, you will meet your facilitator, and there will also be somebody who is recording information to take notes. We would like you to know that this is a safe space for you to talk. All information is confidential and de-identified. The recording of the webinar will stop. And so we want to make sure that we are really hearing your words, your authentic information, so that we can continue to build this this database of information that will help all of us to move medication safety forward across this country. So we are going to give you about 20 minutes. I think all of us could talk for hours on this topic. But for the purpose of our timing today, we are going to give you 20 minutes. And then once we come back together at the end of the breakout rooms, I'm going to ask the facilitators to just share one moment, one gem of part of the conversation in your breakout room so we can hear about what is happening, what are people's voices saying. And again, all of this is de-identified information. So please know that that is the case. We encourage you to engage in positive dialogue. We encourage you to actively listen to each other and contribute to the discussion. We hope that this breakout room will give you the opportunity to take the time to be able to speak. In a large group, it's not as easy, so that's why we wanted to send everybody out and have a smaller group opportunity to learn from each other. And so if there are any technical issues with the breakout rooms, if you find you are not being redirected, you can just stay here and Rajiv will support you and move you through. Everything should happen automatically. And if you need any support, you can check in with Rajiv. And en français, s'il y a quelqu'un qui veut parler en français, s'il vous plaît, dites-le à Rajiv et il va vous mettre dans la discussion, the breakout room. Okay, so with that, thank you. Rajiv, can you send us all to our breakout rooms?
Will do. Here we go. Thanks, Melissa.
Thank you. That all of you incredible conversation like we did in our webinars. So I just would like to take a minute or two to hear from some of the facilitators about what was the conversation in your room. Like I said, we could have been in there for an hour and a half, but unfortunately today we only have 20 minutes. So is there a facilitator who could volunteer to just give us one gem from your breakout room? Time is marching on.
Hello, Melissa. So Mike Hamilton, Medical Director at ISMP Canada. We had a terrific conversation with a number of personal stories that were very sort of generously offered. And I think we're in the medication error, and the question was where our medication error is most likely to occur. And I think we had some really good points about transitions of care. Not any one physical location, but where communication has to be sent from one system to another or one person into another. That's a typical place where medication errors occur. And also sort of a breakdown, I'll say in resilience maybe, where things have to change for some reason, whether there's a drug shortage, whether there's a change in prescription, where those changes cause sort of secondary effects that really can increase the risk of medication error. So wonderful conversation we had.
Thank you so much. All such important information to capture as we move this forward. And I'm just conscious of the time. We're running out of time. So thank you all for your, oh, Julie, jump in. And then we're going to move on. Julie, you're muted. Julie, you're muted.
Okay, sorry. We had also a wonderful conversation, and again, we could have talked for hours. I want to share one of our participants who said that when patients come to us with questions, we need a celebration attitude. So we need to really welcome those questions, encourage them. If somebody comes and says, I'm not sure this is the right medication, we need to really commend them for bringing that forward, for being engaged. And just also this whole idea that we need to bring patients in as equal partners.
Amazing. So true. You will get my full support as patient and family advisor with that. If there's any other gems that you'd like to share with us and share with everybody, please put them in the chat. This is just such valuable information. And thank you so much to all of our facilitators and recorders for supporting with that. As we mentioned, we want to continue our conversation, and one of the ways that we can do that is through an online connection. And so we've created a group on LinkedIn called the Canadian Medication Safety Network, and it will only be for network members. You don't need to be on LinkedIn already. You can sign up for a LinkedIn profile. If you're not comfortable with that, then please know that you will not miss out on any information, any vital information that network members need to hear will come through email from ISMP Canada. So please, by all means, join that group if you are comfortable to do so. If not, and social media is not for everybody, and that is a-okay. Please know that you will not miss out on any kind of information or events that we are planning and moving forward. So we have one more poll to ask you to contribute to. And this is really about how we move this work forward and how we move this learning forward together. We want to know, what is it that you want to learn about in a future meeting? So we're going to give you these options in just a minute on a poll, but I wanted to just walk through them first, and we're going to give you the opportunity to choose your top 3. And so the first one is polypharmacy, and this is somebody who is taking, I believe it's more than 5 medications, and my medication safety experts can correct me, but this is polypharmacy is when many medications are taken by one person. Would you like to learn more about the overprescribing of medications, for example, opioids and antibiotics? We hear a lot about this in the news. Perhaps your prescriber has spoken to you about that, or your pharmacist. The prevention of harm from known information. Sometimes patients are prescribed medication that they have an allergy to, or that will interact with the medication, and although it's already known by the prescriber and the pharmacist, it gets missed. Would you like to know more about the cost of medications to consumers? We know that in today's world, costs of medications can be quite high. Cost of living is quite high. So is that something you would like to continue the conversation with? Creating a culture of medication safety where people are safe to speak up and safe to find ways to improve medication safety. Would you like to talk about medication and healthcare provider shortages? We hear about this all the time in the news and online. And then cost, sort of as related to the operations of the pharmacy. So primarily community pharmacy, but there are high costs incurred at any pharmacy. So these are your options. Please choose your top 3, Rajiv. If you could launch the poll. And then we want to hear from you what is going to be interesting for you as we move this forward. Yes, Donna, thank you. Overprescribing of antipsychotics as well is a big concern for many people. The culture of medication safety was something that we spoke about in our communication breakout room, that it's so important, and we don't want it to be an add-on to people's day. We want it to be embedded in the work that they do, and the challenge around finding the way to do that. Shortages are a hot topic of conversation, absolutely. Yeah, prevention of harm from known information. Unfortunately, those errors continue to happen. Okay, if we can end that poll, Rajiv, I'm just watching the time tick by. We do want to continue to hear about any errors or near misses that you are finding. Please let us know. We have a consumer reporting platform. It's called mederror.ca, and then our healthcare professional reporting platform, which you can find at ismpcanada.ca. Please let us know what's going on with medications in your experience. And then here are our next steps. I would ask you if you are able to scan the QR code and complete the survey about today's webinar. We want your feedback. We want to continuously improve, and we are listening to you. Thank you, Alice, for putting the link in the chat as well, if that's helpful for you. It'll just take you a couple of minutes to fill out. Join us on LinkedIn if you'd like. We'd love to build that community as well. And then we're already thinking about the next webinar, which hopefully will be in the spring, where we can bring this information back to you and continue the conversation. So on behalf of the ISMP Canada team, I would like to extend a big thank you to Dr. Chapman for being here today, to our breakout room facilitators and our recorders. Thank you for supporting this work, and the team who helped all of this come together. And thank you, Rajiv, our tech genius, and all things technology for this webinar. I'm so grateful for your support. And thank you to all of you for taking time out of your busy day. We understand, we know how busy you are, and for you to be here and spend this hour with us is really important. So we really are grateful for your time, and we hope you'll stay connected. If there are any, if there's any other information that you want to share with us, you can connect with us in any one of these ways. medsafety@ismpcanada.ca is the email that's dedicated for the network. So by all means, if there's something you didn't get a chance to say today, if there's something burning that you want to tell us about and talk about, please by all means send us an email. If you find ways to improve, please send them by email. We really want to continue this conversation with you. So I thank you. Have a great rest of your day, and we will see you next time. Take care, everybody.